Hello, everybody. Here we are moving into the second set of PowerPoint slides for the Family Intervention or Improving Family Interaction unit. At this point, hopefully you watched the first set of slides that defined family intervention and also defined the term interpersonal competence. If you haven't already done that, I encourage you to go back and take a look at those that quick set of slides. In this lecture, we are going to be talking about different levels of family interventions. And so if you've done the reading, you may already have an indication of the three different levels that we're going to be talking about. For each level, we're going to talk about the target audience, some of the particular things that are done during the intervention, and then also some of the outcomes associated with that kind of intervention. So let's go ahead and jump right in. All right, so the first level of family intervention is called primary prevention. And primary prevention really is a form of intervention that targets people who are actually in healthy, functioning relationships. Probably the most common example of primary preventions are those that are targeting engaged couples or any type of premarital workshop that I can think of would fit into this primary prevention category. Many religious institutions require couples to attend some type of primary prevention before they are allowed to, before they will marry a couple in that religious institution. So some of you may have participated in this type of program, or certainly many of you may already know friends or family that have. Right? There's some really kind of interesting things to think about when it comes to this level of intervention. The first is that often it's the couples that, or I guess the families that need the intervention the least that are the most likely to attend this type of intervention. And if you kind of think about that, I hope it makes sense, right? I think what we're saying there is if you are kind of willing and motivated and interested in improving and enhancing your relationship, odds are you may already be kind of committed to your relationship and invested in it, and maybe are even already doing some of the kind of, I guess, right things in your relationship. So, yeah, so interestingly enough, the people that really kind of need these interventions the least are the ones that are actually attending. Now, in addition to that, what we know is that, or most data tends to indicate that prevention is often much more effective than treatment after something has gone wrong, right? Preventing problems and conflict and issues from arising in the first place is better than having to fix and deal with those problems after they arise. Right? I think there's probably a lot of different analogies you can think about for why this makes sense, right? And certainly not just relational health, but physical health, I think, is a good thing to think about, right? We give people vaccines, people take medicines, we're encouraged to eat healthy and to exercise. All of those types of things are preventative measures, right? Because we know when people are able to prevent physical illnesses, they are better off than getting the illness and then having to treat it or try to fix it. And the same is true for relationships. One other thing that I think is kind of interesting, I don't know, problematic or just something to think about in terms of these primary preventions is that most people, when problems within a relationship start to arise, don't exactly go jump at opportunities to work on those issues. On average, romantic couples tend to report waiting 6 to 7 years after problems arise in the relationship to go get help. So it's kind of like, okay, we've let this issue fester and we've had these problems for years now, and maybe we're just about ready to call it quits. And at that point, we go seek out some type of intervention, right? That's a pretty common scenario for a lot of romantic couples. So certainly that's something to think about, and the implications of that are also, I think, worthy of kind of thinking about a little bit on your own as well. All right, but anyway, primary preventions, they're targeting individuals that are in basically healthy, functioning relationships. With that being said, that means the content of these particular types of interventions tend to be much more about education and enrichment. These programs tend to involve various types of skills training to simply enhance or improve the communication that's already occurring, right? There are kind of a wide variety of outcomes associated with the various programs. Unfortunately, we don't necessarily see consistent, significant, long-term differences among people who attend primary prevention programs and those that don't. Usually people who attend programs immediately following the program have positive attitudes, report appreciating the experience, and walk out feeling like the experience was a worthwhile experience, but that those feelings often kind of dissipate or kind of fade, and some of what occurred or the goodwill that happened during the intervention, may kind of slowly over time go away. Now, with that being said, we do see that often people who have attended some form of primary prevention at some point in their relationship are generally more willing to attend future interventions. And so that is certainly an important and a positive outcome that can be associated with these primary prevention programs. Your book mentions one particular primary prevention program, and that is the PrEP. And so I encourage you to take a look at that as you're reading through your chapter. Essentially, this program is geared towards romantic couples or couples that are engaged and getting ready to get married. The program is consistent with most primary prevention programs in that it is all about good communication skills. There's a real focus on trying to clarify and evaluate expectations. One activity that is very commonly used in this type of program is simply encouraging individuals to sit down and to independently explain their vision of a good spouse, right? And then once that's done, the couple can compare notes and have good conversation. That seems simple, right? It seems like a really easy thing to do, but it's something that a lot of times gets overlooked. Right? And it's possible that there are a lot of different ways to be a good spouse, right? There's no one specific definition of a good husband or a good wife. And so it's possible that two individuals in a couple may have really different ideas and really different expectations about what spouses do for each other. And unless the conversation about that occurs, it's really easy to then down the road have misunderstandings and miscommunications and so on. Right, so a big part of the PrEP program is enhancing these communication skills and really clarifying and identifying expectations. Okay. Let me pause the recording right now and pull up an additional video that is one more really kind of interesting example of a primary PrEP program. So hold on for just a minute.
Why did you marry me?
So I hope you found that type of intervention kind of interesting, right? It's certainly a different approach and kind of a creative approach. I think it's worthwhile taking a few minutes to think a little bit more about why watching movies together as a couple might actually be such an effective way to help couples interact, right? To say that this simple activity is actually influencing or reducing divorce rates is pretty powerful. So, of course, one suggestion that was offered was that when couples watch movies together, they're simply spending time together, right? And certainly that's an important piece and shouldn't be overlooked. But as the video points out, it's really more than that as well, right? We need to look at what are couples doing when they're watching these videos. And I think there's probably a lot of things that are important that are happening. First, I think one thing we should think about is, think about what you're doing when you watch a video, right? You're kind of like a third party or an outside kind of objective viewer, right? And so if you're watching movies about other couples with your romantic partner, then you are able to kind of watch what's going on in these, relationships on the screen, and you may see some similarities or you may see some differences in how those couples act with how you and your romantic partner act. And it's a lot easier to talk about how those individuals on the screen are acting than maybe some of the specific stuff going on in your own relationship, right? Something about watching those actors on the screen allows you to kind of make things less sensitive, less personal. If you discuss particular behaviors, it's easier to not be as defensive or feel as vulnerable. So by watching other characters in relationships, it's a way to talk about relationships with being able to kind of remove some of the vulnerability that comes with talking about your own relationship. So I think that's a really big piece of what's going on here, right? And you can bring up things in a way that's much less personal and less sensitive than if you were just simply to start talking about your own personal relationship, right? Also, probably when you're watching the movie, you are, happy, calm, enjoying each other's company. And that also is, of course, the time when it's easier to talk about relationship types of issues than when they just crop up within your own relationship, right? Usually when something happens within your own relationship, we tend to be kind of tense or irritated or, frustrated in some way. So I think that's an important thing to point out, right? Additionally, some other things I really like about this particular intervention, and they're briefly pointed out in the video, is that this is such a simple and accessible activity, right? I don't think that there's really any stigma or negative ideas about couples sitting down and watching these movies together. Whereas there, unfortunately, I think is still some stigma associated with couples who seek some type of intervention or, counseling, right? So it's nice to be able to kind of remove that stigma. Additionally, this is a very easy thing that essentially any couple could do together, right? You don't have to go to a separate location and spend an entire weekend at some workshop with maybe some people you don't know. You can do this from your apartment, right? And you can do this at any time that you want to, right? So I think that's an important piece as well. So if you find this at all interesting, I'll post the regular link as well. And if you had any trouble watching the video, you can find the regular link as well in our module. And if you click on the website where the video is, you'll see that they also offer a list of movies that you might consider watching with a romantic partner, and they provide some questions or some conversation starters, right? Because it really is important that you're not just simply reviewing plot lines, but you are kind of having conversations about the actual interaction that's occurring during the movie. So take some time to check that out if you thought that was kind of interesting. Okay. All right, well, so at this point we have covered primary preventions. So let's move forward now and talk a little bit more about secondary prevention. Secondary preventions are targeting participants that are kind of potentially at risk. And so there may not necessarily be severe problems, or the family might not be in crisis mode at this point, but these individuals, for whatever reason, possess some risk factors. And we know that really simply being married for a while is a risk factor, right? We know that in general, marital satisfaction tends to decline over years. And so simply having been married a while would people who've been married a while might be a target audience for this type of prevention. Individuals who just recently had a newborn baby, right? We know there's a lot of stress involved with bringing an infant home from the hospital. So they might be a family that could be targeted for this type of intervention. Families that have a member of the family that's deployed and is away from the rest of the family due to military obligations. They would, there are lots of secondary intervention programs targeted towards military families. So you can see secondary prevention programs, they're targeted towards individuals that are kind of at risk, that possess some additional stressors that might present some strain on the family relationships. Again, though, within these programs, the real focus is simply on communication skills and managing expectations, right? When in all the situations that I just mentioned, they kind of refer to experiences where things are changing or some part of the stability of the relationship has changed, and so now there needs to be kind of a new way to adapt to that. And so these programs really focus on that and deal with some issues related to how to communicate about these changes and what might be some new expectations related to these changes. Data regarding the effectiveness of these programs, again, is a little bit mixed. There do tend to be some immediate increases in skill and satisfaction right after attending the programs. But again, some of the long-term effects tend to be, the verdict is still kind of out on that. Your chapter identifies some very specific programs, and you can see some variations based on some of the specific programs. Couples communication program is one example of a secondary intervention. In this case, the main argument of the program is that interpersonal competence can be taught and learned. And I hope based on our previous discussion of what competence is, you agree with that statement and you can think about what that might look like to help teach people and help people learn how to become more competent. Often, or a big part of the couples communication program is simply trying to help individuals become more aware, both of their own behaviors as well as their perceptions of other behaviors. And addressing this awareness is a pretty powerful experience. When I am teaching this class face-to-face, sometimes I have students kind of engage in an exercise that occurs at the couples communication program. And when we do that, we do some role play that looks at intent versus impact. So I'll just describe it here really quickly for you. So intent, of course, has to do with the message we intend to send, right? The point we want to get across to the other person, or the reasoning or the rationale behind what we're saying or doing. What we know is our intentions are not always accurately perceived or accurately conveyed to the individual we're interacting with, right? So impact is how what we said or did impacted the person we're interacting with, right? Sometimes my intent matches my impact, right? What I meant to say or what I meant to do does in fact land in the way that I thought it would. But a lot of times, especially when conflict arises, it's because intent and impact didn't match. So maybe I told a joke and I was just kind of joking around and my intent was to de-escalate things, to lighten the mood. And I thought, that the joke was just an attempt to kind of lighten things up. But the impact was that it really pissed my partner off, right? And it just angered them and they thought that I wasn't taking something seriously. Right. So again, this idea of intent versus impact is really important when it comes to dealing with issues of self-awareness and other awareness. It would certainly be a topic that would come up at the couples communication program, among other activities. Finally, we have tertiary programs, or this kind of third level of intervention. A tertiary program is going to target dysfunctional families. So these are families that are in crisis mode, that are dealing with a major stressor, and that are really no longer functioning at this point. Sometimes these programs are geared towards individuals that may have some kind of addiction, that may have an alcohol or drug problem. Sometimes these programs are targeted at children or adolescents who, for various reasons, are kind of in crisis mode. Sometimes the programs are voluntary and people select to participate. Sometimes with these programs, they're not voluntary. They may be ordered by school authorities, or they might be legally mandated based on the circumstances. With tertiary programs, we're really not simply talking about education and enrichment anymore. Now we're really talking about a curriculum that's focused on resolving problems, fixing the issues, not just with one or two members of the family, but often everyone in the family, right? And if you think back to systems theory, you can think a little bit about how important that is to recognize the family as a whole. But the content of these programs address the problems, address the stressors head on, and in turn, hopefully attempt to reduce the stressors involved or associated with those various issues. And of course, with this, it's difficult to identify specific outcomes because they vary so much based on what particular tertiary program that you're talking about. You will find in this particular module that you will be watching an example of Parent Aid, which is a tertiary program that's focused on helping caregivers develop more effective parenting strategies. And when you're done watching this video, I'm going to ask you what you think the specific results for the 3 families involved are going to be. Right? In general, the Parent Aid program has positive outcomes, but I'm going to give you a chance to kind of think about these specific families that you follow. Okay, so in general, it really depends on which particular program you're looking at to be able to identify the outcomes. Now, within the tertiary programs, a really common technique that's used is something called cognitive behavioral therapy. And you may have heard of this in an education class, or perhaps if you've taken any type of psychology classes before. The general idea of cognitive behavioral therapy is that our behavior is either maintained or changed based on the use or misuse of reinforcement, right? And it involves changing behaviors, not just changing behaviors, but also changing the way we think about things. And there are some kind of specific components that I want to highlight here. And let me identify these components and talk about them a little bit. But I'm hoping you make a note right now as you're listening to this to keep an eye out for this. For these things in the video that you watch, right? When you're watching the Parent Aid program, I think you'll be able to, if you're kind of watching closely, identify varieties of examples of the use of cognitive behavioral therapy and these specific components. Okay, so behavioral contracting is one of the ones that really is what it sounds like, right? It's the idea that individuals kind of create this contract or agreement about the behavior they intend to implement. Right? Now, an important part of behavioral contracting is to avoid contingencies and if-then types of statements. A lot of times it's easy for us to say, well, I'm only acting this way because that person's acting that way. And I'll only change if that person changes. Behavioral contracting really forces people to get away from that and simply create a contract about their own particular behavior, separate and apart from how other members of the family might be acting. Okay, mutual acceptance. This is the idea that sometimes we simply have to learn to accept the fact that there are some things we cannot change about others or about our family members. So mutual acceptance, kind of accepting the fact that we can't change other people. Now, I want to be careful when I talk about this one. I certainly am not suggesting that, if you use mutual acceptance, you should just go along with any particular behavior that your family members might be engaging in. No doubt, there are some behaviors that are simply deal breakers. Right? There are behaviors that we could be talking about that are abusive and violent, and I'm not suggesting that you should just accept. That people should just accept that's how others are. It's important to define what you consider to be a deal breaker and what isn't, and then to recognize that certainly within that broad category of things that are not actual deal breakers, kind of realizing that some of those things you probably can't accept or maybe not as big a deal and don't need to be changed in a way that you might have originally thought. Okay, self-regulation is specifically about the idea that I can control my behaviors and not anyone else's, right? And it's up to me. If I want something to change, I'm the only one that can change how I think and how I feel and how I act, right? So taking control and taking accountability for my own actions is what we're talking about when we're talking about self-regulation. And then finally, cognitive restructuring. Again, cognitive means thinking, right? And so restructuring means to restructure or reframe the way we think, right? And so I think a lot of times it's really easy for all of us to get into a rut of how we think and to ruminate on certain issues. And so cognitive restructuring forces us to kind of rethink about things. I'll go ahead and mention, one example from the video that you're going to watch. There is an example I think that's really powerful of this cognitive restructuring. And one of the individuals involved in the intervention, one of the helper mentors, basically says, you know what, this grandmother needs to realize that her children are not acting how she wants them to act. But the truth is, she kind of helped create the monsters that they've turned into. Right. And so up until that point, the grandmother kind of has been blaming the children and really kind of felt like a victim. But when this mentor kind of points this out to her, then it's kind of encouraging her to rethink about this and think about, well, what's my role in the chaos that is involved in our family right now? Right. So that's what cognitive restructuring is, rethinking about something. Okay, so at this point, I'm going to wrap up the lecture, and I'm going to encourage you for the next thing to do is to take a look at the exercise for this module, which is watching the family intervention video. When you're watching that, note that you're going to be responding to it in the discussion posts. So you might take a quick look at the discussion questions so you can have that in your mind as you're viewing. And of course, if you have any questions or concerns about any of these assignments, just let me know. Thanks.